There are 3 steps involved in removing and replacing your tooth with a dental implant. The first step is for us to remove your tooth and place a bone graft. So you can imagine where your tooth was, there's an empty space in the bone, and we fill that space in with a bone graft material. The bone graft material is human bone from a tissue bank that looks like little sand grain particles. And it's a way to trick your body into making your own bone there. Anytime you take a tooth out and don't put in a bone graft, you can lose up to 50% of the bone that's there. When we do place a bone graft, we only lose up to 5%, and this sets us up really nicely to be able to replace it with a dental implant. Once we've bone grafted an area, it needs to heal for about 4 months before we can move on to the next step, which is placing the implant, which gets us on to step 2, placing the implant. The implant itself kind of looks like a screw that goes into the bone, but you could think of it like a fake root. It's made out of titanium, the same thing a hip replacement or a knee replacement is made out of. The reason we use titanium in medicine and dentistry is because bone actually fuses to it. So even though it looks like a screw that we screw in, it's not something you can just unscrew later, because your bone will actually physically attach to it. And that process takes about 3 months. So far we've removed the tooth and done our bone graft and needed to let that heal for about 4 months. Then we place our implant and that heals for about 3 months. Then we clear you to move back on with your general dentist, where they will take an impression, like molds of your teeth, and they'll have a lab make them 2 parts, the abutment and the crown. Those get connected together, and then in real life that screws into the implant and is how we can replace your missing tooth.